Dr. Sexton, thank you so much for joining us today.
Hey, thank you, Karen.
Yeah, let's talk about, first of all, these numbers, because we've had a couple of days in a row where we had over 600 yesterday statewide, over 500 today, and it's just been kind of steadily increasing, and this is a pretty big jump this week, actually.
Yeah, it is, and the hard thing about that is, just like any other virus, is it's going to, mutate, and, we have the answer there, and the key is just to let people know to get vaccinated, to continue to show, the studies and trying to get, the accurate information out there and showing safe efficacy. Studies all the time, when you combine it with, RSVs, rotaviruses, flu, all these viruses are going to mutate, but studies show whatever virus we're talking about, if you get vaccinated, the symptoms are going to be much less severe, and we're seeing that in this case.
And, of course, you're a pediatrician, the director of pediatrics there at Singing River. What kind of feedback are you getting from people regarding children and the vaccine? Because I know there have been some concerns, particularly with that rare heart problem that can develop in young people.
Absolutely, and it's they have the right to be nervous, to be afraid, and anybody that's affected with COVID-19 is heartbreaking, but when it affects our children, even more so. And it's always a big deal if you're the 1%, and this is still, I don't want to downplay any of these things these kids are going through, but still, thank goodness that this is a milder disease in the pediatric populations. But when you're combining these kids getting back together, social gatherings, kids are passing around different viruses, and when you compound it with the COVID-19, it causes these inflammatory responses and cardiac effects there. Again, these are much smaller possibilities that they affect, but it does have cause for concern. And so it's very important to talk to your healthcare provider about this. But I will tell you, it is safe and effective, and we are, at the 12 years and older, recommended that it gets vaccinated to your children to help them avoid higher level complications.
And so you're telling people to go ahead and get the vaccine, even with that rare risk that we've been hearing about, because I know that's one of the things people are concerned about with kids.
That is correct. And again, it's okay to be concerned. We deal with vaccines and vaccine side effects all the time. This is not new in pediatrics, although this, COVID-19 vaccine is new. And so it's very high level and high perspective in terms of the public eye, and we need to be continuing to learn about it. Our vaccine risk factors or vaccine side effects, we deal with them. And as pediatricians, the benefits still way outweigh the risk in terms of protecting against these communicable diseases, and we can save these children.
Yeah, and of course, with more children vaccinated in that 12 to 18 range, it will also trickle down and help other kids that are younger in the family that are unable to get the vaccine at this point, and then also affecting other family members, perhaps.
No, it will, and especially we need to look at these other, high-risk populations that can't get the vaccines, and these special needs populations. Kids with special needs, CPs, a variety of gambits. It's not just about each individual; it's about all of us and the entire family and the younger kids. And so, whatever we can do to protect our families and their downline, it's important to do so. So that 12 to 18-year-old range, the young adolescents and older, it's a great opportunity for us to touch that population and therefore protect the elderly by not transmitting the disease, and also our younger children. And if you have a special needs in the home, it's very, very important to get your vaccine.
All right, Dr. Tyler Sexton, Director of Pediatrics at Singing River. Thanks so much for joining us today.
Thank you.